Good afternoon, and thank you for the opportunity. Today morning, we talked about the necessity and why muscle sparing techniques, especially the lateral approaches, can provide better care for a patient. And now I'm going to talk about actual technique. Please take a picture of these QRCs. You can get additional information from them. And as we talked today morning, it's not about the skin incision. What happened under the skin, the damage that we don't do in the minimal invasive surgery makes the minimal invasive. And that's what the patient benefit from. We talked about that all muscle sparing technique, practically anything besides TLIF and PLIF, they are able to preserve paraspinal muscle and so vascularization of the bone, keep the dynamic of the spinal muscle, and lead to faster recovery and better outcome. Today, I'm going to talk about two of these approaches that I do perform regularly, oblique lateral posterior interbody fusion and MIS-TLIF. More importantly, MIS-TLIF is so-called prone lateral, and OLIF is very distinct from OLIF ATP. This OLIF is in prone position with posterior approach. Here you see the approach window for each of these procedures. This is oblique view. For that reason, the OLIF approach seems to be bigger than DLIF approach or direct lateral approach, but in truth, in a lateral view, the DLIF approach is much bigger. More importantly, in the OLIF approach, there's a confine of the Cambin triangle that you can push against the nerve root. In the DLIF, this confine doesn't exist. As well, with the smaller footprint in the MIS-DLIF, we are not pushing against the surrounding structure and make a big hole in the psoas that put the disc and the nerve or lumbosacral plexus at risk, especially at L4-5 and 5S1. For this reason, MIS-DLIF is very suitable in the L5S1 and L4-5. Now, if you have interest in the actual technique and the paper associated with that, these are the QRCs. But more importantly, as you see here in the AP and lateral, in the OLIF, you are lateral to the or anterior in the